Hi, this is Chris Centeno. Sorry I couldn't be here in person for this lecture. I was here earlier in the week, but had to head home due to the coming storm. Now, I grew up in Florida, so I know that this storm could be anything from a real hurricane to a joke. And it looks like it ended up veering away, but I had to make plans to get back early prior to knowing that. So apologize for not being there in person. So title of my talk today is Trailblazing Regenerative Medicine. And I like this quote: if trailblazing was easy, the road would be paved. So way back in 2005, I did what was either the dumbest or the smartest thing I ever did in my life. I injected culture expanded bone marrow derived mesenchymal stem cells into the low back discs and knees of patients. And I was inspired by this 2005 paper. Basically, they were able to take culture expanded bone marrow mesenchymal stem cells injected into rabbit discs and basically regrow or recreate degenerated discs. And that inspired me because I was an interventional pain physician and I was injecting steroids with wild abandon, and it kind of helped some patients, but it really didn't change anyone's trajectory. The trajectory was usually in a bad direction. And I was looking to try to find treatments that would actually help these people long term. And on Earth at that time in 2005, nobody else had injected culture expanded stem cells to treat orthopedic conditions. So I was the first on Earth to do that. Philippe Hernegal in Paris, France, had already injected bone marrow concentrate, mostly into bones at that point. He's an orthopedic surgeon. So Philippe was another inspiration for me. I've since had a chance to meet, spend some time with him, great guy. So between he and myself, we really were the fathers of this field of injecting things into patients that had the term stem cell to help their orthopedic problems. So for 2 years, this was an IRB approved and closely monitored study. So from 2005 to 2007, we didn't charge anybody. We treated about 50 patients during that time. We also used bone marrow concentrate in addition to the culture expanded cells. And we treated low backs, intervertebral discs, knees, and hips. In 2007, the study was completed showing good results for knees and hips, but no real results for low back discs. And that took us a while to figure out how we would treat low back disc with cultured cells. We eventually figured that out. That led to a patent and ultimately a phase 2 FDA trial. And we then began offering the cultured bone marrow MSC therapy to our patients after a 2-year period where we said, okay, this works, this appears to be safe, and let's offer this to patients who understand the risks and benefits of all of this. However, that led to the FDA questioning whether the use of culture expansion made these autologous cells a drug. And that detour took us several years to resolve. Ultimately, they are drugs, which led to FDA approval studies on our side. Obviously, a much, much bigger gauntlet to jump through. And early on, we were able to publish case studies in the knee and hip and a safety paper. So we've always had this thought that we need to publish as we go because this is a new field. And that's the requirement really for any new technology. So in 2010, we had switched to using PRP and high dose bone marrow concentrate because we could no longer use the culture expanded stuff. And we were ready to show others how to do all of this so we established a provider network that now is about 70 strong or so across the US. And eventually, all of that led to a local billionaire, John Malone, to give us money to start an educational nonprofit, the Interventional Orthopedics, or now OrthoBiologics Foundation. So all of that led to some interesting things that we never would have expected back in 2005. And realize that we established during that time a state-of-the-art research lab staffed by PhDs to improve what we do and to understand orthobiologics at that cellular level. And we still run this lab. So we have a university-equipped lab in our medical practice, which is something that's very, very different. There are very few medical practices on Earth that have research horsepower on the lab side behind them outside of universities. So we have a full team of lab experts who are constantly doing this research on the lab side to improve our understanding of what to do and why. And realize that when we started this, there were no kits. Kits didn't exist. There was no bone marrow concentrate kits. There were no PRP kits. So we always did everything ourselves in the lab. And that led to our current lab, which you see here, which is about 1,000 square foot CGMP class clean room facility. That's, again, part of our medical practice. So this is another thing that we have in our medical practice that's just not common, to have a clean room processing facility where we can process hundreds of patient samples. Now, obviously, this gives us a distinct advantage, right? We don't have to deal with whatever output is produced by kit A or kit B or kit C. We have the opportunity to custom make orthobiologics for our patients, obviously minimally manipulated ones. And during that time, we also began Interventional Orthobiologics Fellowship. We've trained 14 fellows since 2011. We now take about 2 a year. So if you've got any interest in interventional orthopedics or interventional orthobiologics, we have a fellowship program. And it's been fantastic training young doctors how to do this stuff. And our fellows are highly sought after because everyone is adding orthobiologics to practices right now, so they get jobs fairly quickly. We try to keep as many as we can in-house in Colorado, but obviously they end up getting scattered to the wind because there's lots of job opportunities out there for them. And so listen, when I started all this stuff, my goal was to try to publish it, but I never really understood how far this would get at that point, 2005. So this is a list of current publications. So as you can see, we've continued to publish on all of this stuff, and we'll continue to publish usually 2 or 3 papers a year. So what have I learned? I think the first thing I've learned is, take a risk. This was a huge risk at the time we were doing this work. If things had gone bad rather than good, we could have lost our medical licenses. I mean, that's really the truth. Now, all of this stuff that we ended up doing has now become either standard of care or subject of extremely serious research, and it's all turned out to be good things. So we took some calculated risks, but I think I learned that taking risks is good. I also learned that taking risks has its downsides, right? Not all of this was absolutely fantastic. Some of it, we ran into snags here and there. And I love this quote from Moneyball, the first guy through the wall, he always gets bloody, always. So we were really the first guy through the wall to do culture expanded cells and also to use bone marrow concentrate in many, many clinical indications. And that wasn't always easy early on. Right now, it seems like, oh, sure, that's no big deal. It's done all the time. But when we were doing this stuff, I talked to orthopedic surgeons about what we're doing, and we were voodoo doctors. Even for using PRP back then, we were voodoo doctors. For using bone marrow concentrate, we were voodoo doctors. For using culture expanded cells, we were voodoo doctors. Now, obviously, again, looking back in hindsight, that seems silly because this stuff is becoming the focus of randomized controlled trials with successful results, etc. But we got bloody before we got good. So just to realize that that's part of innovation. And, the regen med field right now, regrettably for me, has become like a bad game of telephone. Listen, I see lots of folks on the podium where when I talk to them and I try to really assess their knowledge of whether or not they know the basic science behind what it is they're talking about, they generally don't. Now, there are some exceptions out there, but one of the things I would tell anyone working in regen med is really do your homework. Learn the basic science behind what it is you're doing, not just I went to a weekend course and I learned something from someone who learned something, from someone who learned something, from someone who learned something from someone like us. So realize that there is a game of telephone out there. And in order to get really good at this stuff and to become a true expert, you've got to learn the basic science behind every step you take. And thinking outside the box, obviously, is huge. For me, I've always had no box. If I hear something that doesn't make sense to me, I don't care if it's dogma, I will question it. And I think that's an important skill to learn. If you need to question in medicine everything you hear, even though it's dogma. Why do we do it that way? Is that the best way to do it, or is there a better way to do it? And that's a hard thing for some people. For others, it comes naturally. But think outside the box. It shouldn't just be a metaphor. It really should be the way you live your life. And, now I'm kind of moving into the last 10 years of work for me. I'm not the kind of guy that's going to die at my desk. There are many that do that. There are many that want to work into their 80s. And I will continue to do things, I'm quite sure. But I'm definitely going to be winding it down over the next 10 years. So we've produced some wonderful fellows who can take that torch. And I would also challenge you to take that torch, to do more research on regenerative medicine and orthobiologics, so that all of this can one day become standard of care. Meaning right now, PRP is getting close. Bone marrow concentrate is inching closer. But sometime in the next 10 years, everything that we started in 2005 will become the standard of care, maybe by 2025, 2030. And that shows you it took 25 years. It will have taken 25 years for this stuff to move through that gauntlet. But it's really your turn right now. So if you're young and thinking about doing this stuff, this is your chance to change everything. Because I will be kind of heading off into the sunset here in the next 10 years. So thanks so much for listening. I hope this was helpful in seeing how we were able to innovate early on and how long it takes for new innovation to get through that gauntlet. And, listen, if you're an innovator, you're going to be bloody before you're good, but you'll look back at all of that and laugh. So thanks so much for watching and have a great day.